Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navipet, Pune. Today, let us talk about which patients have to hurry up for a test tube baby technology. Now, by which this means that patients can undergo normal cycle or a planned intercourse or IUI cycle, but still there are certain subset of patients in artificial reproduction who cannot conceive naturally and who have to really hurry up for an IVF or ICSI technology. So who are they? First, severe endometriosis. Now this is a dreaded disease and it's a very complex disease in which both-sided ovaries are having very poor quality oocytes because of a disease which is known as endometriosis, which is a degenerative disease in which it goes on complexly having pathologies throughout the reproductive system, which may give endometriomas or cyst, or they may attach itself to the bowel or bladder and may cause complex pathologies in the abdomen. If this patient has her own eggs, it is very important to hurry up for a reproductive technology so as to have a child as soon as possible before the endometriosis spreads all throughout. Second, severe PCOD patient. Now these are critical or these are tricky patients in which they do not have their menses at all. Sometimes the patient do not get menses till we give them medicine. So there are ladies who get menses maybe once a year or so because of very severe PCOD. In such patients, if we still try with IUI, there are two spectrum. In the first, in which in IUI the patient doesn't develop a single follicle in spite of medicine or injection. These are the patients which may benefit with IVF. Or there are certain patients who are predisposed for a very high ovarian hyperstimulation syndrome, and these are the patients in which we have to go with softer protocols or go slow, and these are best responding to IVF technologies. Now, as far as the male counterpart is concerned, there is something which is known as severe oligoasthenospermia, in which the patient's count is less than 5 million, 0% or just 1% motile sperms and highly abnormal morphological sperms. These are the husbands in which, in spite of medicines and injections, they may not show improvement. If they do not show improvement in spite of medication, it is prudent to hurry up for an IVF ICSI technology. The fourth category is advanced age patients. Unfortunately, certain patients marry late because of education or whatever reason it might be. But when they marry at 38, 39 years, they have a very less reproductive age or reproductive time left with them. In such patients, it is worthwhile considering an assisted reproduction technology to get pregnant as soon as possible, because we have hardly 1 or 2 years in our hand, 40, 41-year patient, in which that is the golden period in which we can still make the patient pregnant with her own gametes. Thank you.